Welcome back to Breakfast Central on News Central. Now, the News Central mobile app ensures you stay in touch with the latest news, sports, politics, and more on the go. Go ahead and download it on Play Store for Android and the iOS Store if you're an iOS user. We have coming up next right now, COVID-19 update. And I think we have Mivhael Ngene, who's going to give us the COVID reports. Good morning, Mivhael.
Hey, good morning, Oluchi. Good morning, Joe. Now, it's a lot that's been happening. You know, talking about the COVID-19 pandemic, the numbers are really reducing, if you ask me. And I'm taking you to Nigeria, where the Nigeria Center for Disease Control, NCDC, says the COVID-19 pandemic actually created an opportunity for Nigeria to strengthen its health system. The NCDC disclosed this in a statement to mark the 2 years since Nigeria's first COVID case was recorded on February 20th, 2020. That was just yesterday. So Nigeria marked 2 years yesterday that we recorded the very first case of COVID-19 in Nigeria after that passenger flew into the country from Italy. Now, the agency said while the pandemic has had devastating effects on lives in Nigeria, it also highlighted gaps in global outbreak preparedness. Now, according to the agency, with over 250,000 confirmed cases and 3,000 plus deaths reported up to date, it is said, and of course, it has been a journey of working tirelessly with the Presidential Task Force (PTF), which has now been renamed the Presidential Steering Committee on COVID-19 to mitigate the impact of the pandemic amidst the response to other diseases, outbreaks, especially, the cholera, yellow fever, and of course, the Lassa fever. Now, before I take you to my next story, now, I think this move by NCDC, this statement they have made, is actually very nice because we know how we battled to contain this virus when it broke out back in 2020. We had people that caught the virus, but we were trying as much as possible to have those isolation centers up and running. The one in Yaba took a while before it came up, and of course, other ones across the nation. So people were really scared. That was actually what I think, made people more scared than the virus, because when you get, in contact with it, there was no place to isolate you at the moment. So it made us realize that there's a lot that needs to be done in terms of, getting Nigeria prepared for all of these outbreaks that happen. Now, we know how Ebola virus came some years back, and of course, we had the whole people going about the water salt solution. That I know some people that actually did it. I don't know if Joe or Lichi did the water salt solution when Ebola virus broke out some years back in Nigeria.
No, I did not.
No.
I couldn't dare.
No.
Not with the exposure we have. Nah.
Whenever there's a disaster, first thing you do is, one thing I learned is just don't panic. Stay calm. And sanity, stay calm.
Exactly. Now, big shout out to NCDC and, very nice move they're taking. Now, talking about other viruses that break out in the country, the Lassa fever is one thing that I need us to, keep our eyes on, because the numbers are increasing gradually, because Nigeria has recorded 21 deaths and 91 new infections in the week 7 of 2022, spanning between February 14th and 21st. According to NCDC, the new cases were recorded in Edo and Delta State, in the southeastern states of Ebonyi and Enugu, Taraba, Bauchi, and Gombe State in the northeast, Kogi and Nasarawa State in north central, and Ondo State in the southwest. Now, 86 Lassa fever related deaths have also been reported so far in Nigeria, with a case fatality rate of 19.1%. Now, we need to really curb this Lassa fever. Now, we hear that it spreads through rats and other rodents. Please do what you can. Make sure that you probably fumigate your residence, your houses, your compounds, to make sure that these rats don't get closer, because you never can tell which one would pass this virus to you and your family. Now, let me tell you that the number of confirmed COVID-19 cases in Africa has reached a record 11.130 million cases. Now, according to Africa Center for Disease Control, that is Africa CDC, the death toll from the pandemic across the continent stands at over 247,000, while over 10.392 million patients across the continent have recovered from the disease so far. Please ensure you do all you can to stay safe. The pandemic is still out there. The virus is still out there wreaking havoc. Please ensure you use your face mask. Now, South Africa, Morocco, Tunisia, and Ethiopia are among the countries with the most cases on the African continent. And in terms of caseload, Southern Africa is the most affected region, followed by the northern and eastern parts of the continent, while Central Africa is the least affected region on the continent. And that's the beat I have for you on COVID-19 update this morning. Please make sure you stay safe. use your face mask, use those hand sanitizers, and please, please, please stay socially distanced when you're in public. Back to you guys.
Thank you so much, Mivhael Ngene, giving us the latest updates concerning COVID-19 plus Lassa Fever. Yes, spread. It's taken a huge toll on the health sector as well, so we want to be very, very careful.
Yeah, and I just need to add quickly that we're not really giving it the attention it needs. And I don't know why, because it seems to me as though people like to allow these things to escalate to a larger proportion before they start taking steps. Maybe people are using it to probably siphon funds or stuff, but if we can actually start now, we can curb this before it gets to that larger scale.
Well, Michael, I don't know how well we can stay without rats, because in this part of the continent, rats seem to do quite well living in the urban setting, apart from the rural setting. We just need to ensure that we need to keep airtight containers for food, because one major way this disease is transmissible is through food intake, and that's when the particles, the rats, when they defecate on your food. So they always tell us, and when that sensitization has been out there, telling Nigerians, telling people to please ensure that your food are in airtight containers or properly covered. You don't leave them exposed, because they can just be passing by. You never can tell. We have a lot of open drainages in our country, and that also encourages the inhabitation and the growth and spread of this Lassa fever that we have in our country. Until we do that and much more, we might continue to see this story in our health sector.
Well, keep our fingers crossed.
Absolutely. Thank you so much, Mike.